Hi, I'm Dr. Natalie Barnett, VP of Clinical Research at Nanit. The end of daylight saving time, or fallback, might only involve a 1-hour time shift, but it can disrupt your baby's sleep schedule, leading to early wake-ups, bedtime resistance, and general crankiness, especially for infants and toddlers between 4 and 24 months. Here's how you can help your baby adjust smoothly to the fallback time change. First, review your child's sleep schedule. This is a perfect opportunity to check in on your child's current sleep routine. I recommend using Nanit's sleep schedule generator to create a personalized daily routine based on your child's developmental needs. This tool helps ensure they're getting the right amount of nap and nighttime sleep for their age, as well as the right amount of milk and solids for their age. Next, choose your approach. Either a day of approach or a 3-day gradual approach. I generally recommend the day of approach, where you make the adjustment to the new time the day before the clock changes. This method can be simpler for parents, adapting to the new time directly on the weekend when you're home, more likely to be able to control your baby's schedule and avoiding the stress of pre-planning and calculating what bedtime or nap time would have been that previous day. However, if your child is particularly sensitive, the 3-day gradual approach might work better for your family. With this method, gradually shift your child's bedtime 15 minutes later each day. For instance, if your 9-month-old usually goes to bed at 7 p.m., start by putting them to bed at 7:15 p.m. and then 7:30 p.m. and so on until they're going to bed at 8 p.m. the night before daylight saving ends. This gradual adjustment can help their body clock adapt more smoothly. Remember, both approaches can be effective, so choose the one that works best for your family. The key is to stick with whichever method you choose so that bedtime doesn't flip-flop in the days leading up to the time change. Next, focus on sleep cues, not the clock. While it's helpful to consider the timing, try not to stress too much about the clock as your child adjusts. Pay close attention to your baby's sleep cues, such as rubbing their eyes or drooping eyelids. It's perfectly okay if they can only stay up an extra 5 minutes instead of an extra 15. Being overly strict about timing can lead to overtiredness and make it even harder for them to settle down. Plus, focusing too much on the clock can put unnecessary pressure on you as a parent. So stick to your regular bedtime routine, such as a bottle, book, brushing teeth, and then bed. But if you notice your child starting to fuss or doze off, it's okay to simplify the routine. For example, you might opt for just 1 book instead of 2, or move through the routine a little bit faster. The key is to keep things consistent without putting too much pressure on precise timing. And finally, remember to create a sleep-friendly environment. With the time change this fall, the morning light will come earlier. So ensure that your child's room stays really dark with blackout curtains or temporary solutions like black garbage bags or even aluminum foil. A white noise machine can also be beneficial. Nanit lab research has shown that babies who use white noise get an average of an hour more sleep at night. It helps signal to your baby that it's time to rest, even as they adjust to the new schedule. Remember, it might take a few days or even more than a week for your baby or toddler to get back to their regular sleep routine. But with these strategies, they'll be back on track within a week or 2. Hang in there and know that your child will adjust. It's all part of the process. Thanks for watching, and remember, you've got this.